in the past, what OSHA has done is looked at CDC guidance and said to employers, this is the best thing that we know in short order about how to protect workers. So we're going to enforce CDC guidance. Again, the Trump administration isn't doing that. What they've done is put out suggestions, recommendations, tips on how to keep workers safe. But the key thing that you're missing, in addition to sort of a full process for getting the best possible standard, when you rely on recommendations or suggestions, is that there's nothing that's unenforceable. So workers don't have a way to go to the Department of Labor and say, it's supposed to be your job to keep me safe, to enforce these rules so that I'll be safe, and have OSHA then go out and enforce that. You can't do that with a recommendation. And so workers are really stuck. We're seeing states start to step up and actually come up with their own standards, especially as we're learning more about transmission in the workplace. But really, honestly, and not saying this from a partisan perspective, like, the federal government has just sort of sat out protecting workers during this pandemic. There's just no way around it. There has to be a level of government support for people who can't work safely. So in your hypothetical, if that person truly cannot work safely, then they need to have support so that they can continue to support their family, to have a roof over their head. It shouldn't be hard, although it does seem hard in our current political environment, to have a principle that nobody should have to put their lives at risk in order to bring a check. Like, that seems to be the basic level of protection that we should provide workers. And so July, Congress will have figured this out a little bit and make it clearer that workers who really can't work because of their particular health situation do have continued access to that kind of unemployment insurance benefits at home.